Hello. Well, we were shopping today at about 3 p.m. and the store wasn't that busy. And then within about 30 minutes, nearly finished shopping, the whole store was full of people and the toilet paper section was empty. What happened? Well, an announcement at the time we were at the shop from our Premier of Western Australia indicated that we had one community transmission of COVID-19. It was a security worker in hotel quarantine. Now, he uses, like most West Australians, a little app on his phone. So the days that he was contagious is now known exactly where he went, which is many, many places. The reaction by our government, which we've all supported, for 10 months now, since April last year, we haven't had COVID-19 as a community transmission. And I suppose this is not really community transmission other than the security guard catching the virus from people in a hotel quarantine, but it doesn't mean it won't be. At the end of what I talk, you'll see the West Australian Premier, Mark McGowan, explain exactly what has to happen. But I'll give you a little summary prior to that. One, immediately from 6 p.m, which is now, tonight, it's a total lockdown in the major regions of Western Australia, which is about 99% of the population. So the whole state is officially locked down because those outside those areas can't come in here and no one can go out. And along with being a 5-day mandatory lockdown, you stay home, you don't see family, no one. You have to have mandatory mask wearing. If you go out, or if you're in a public place, or if you're on a public transport, you have to go to work, it's mandatory. What is the reactions of West Australians? Most of them just say, okay, let's do it. So we're in a 5-day West Australian lockdown. No one can come in, no one can go out. You have to stay home. If you do go out for essential goods, like going to the chemist or to get some shopping, you must wear a mask. It's mandatory. And to a man and woman in this state, we all agree. One, COVID-19 transmission, and my state shuts down completely to eliminate it best we can. Does this mean we won't have more cases? I think we will. But all those people now staying at home in Western Australia in this 5-day initial lockdown won't be getting the virus. So it's an immediate reaction that we all say, we understand, we have to stay home, and we have to wear a mask. Now, for more concise and clear explanation of what we're expected to do over the next 5 days, which could be more, but these next 5 days, here's the Premier of Western Australia, Mark McGowan.
Good afternoon, everyone. Thank you for coming at such short notice. This morning I convened an urgent meeting of the emergency management team. We have a serious update to provide the West Australian community. At about midnight last night, we received a positive COVID-19 test result. That positive result has come from a male hotel quarantine security guard in his 20s. The information we have is fast evolving. As you can understand, immediately our teams moved into place to begin contact tracing and put in place emergency response systems. This is all underway, and I ask everyone to be cooperative and understanding of what is going to take place. Here is what we know about the male who tested positive. He was working at one of the state's hotel quarantine facilities, the Sheraton 4 Points in the city. He had tested negative for COVID-19 on Friday, January 15th, Sunday 17th, and Saturday, January 23rd, as part of the weekly testing system that is in place. When the man was working at this hotel, there were 4 active cases of COVID-19 in hotel quarantine. Of those 4 cases, we have at least 3 confirmed variant strains, 2 UK and 1 South African. We are told the guard was working on the same floor as a positive UK variant case. The guard completed 2 12-hour shifts on both the 26th and 27th of January. Exactly how the infection was acquired remains under investigation. He developed symptoms on Thursday, 28 January, and phoned in sick and did not go to work at the quarantine facility. The Health Department contact tracing team has pulled together a list of potential exposure sites of where this positive case has been in recent days. The Health Minister will provide that information shortly. The investigation is ongoing by our public health team, and it is likely more locations will be added following further discussions with the man. Anyone who was at the locations is urged to attend a COVID-19 clinic for testing and remain in quarantine whilst awaiting test results. Close contacts will be contacted by public health officials and asked to quarantine for 14 days. The man did use the Safe WA app at mandatory locations. Our COVID-19 testing clinics are being ramped up with additional staff and additional hours, many to at least 10 p.m. tonight. Private testing clinics will also be available for testing, and we are working with them on this as we speak. More information on testing clinics will be available on our website, the WA Health and WA Government websites. The man's immediate household contacts have been contacted, tested and placed in isolation at state-managed quarantine facilities to complete a 14-day quarantine period in a quarantine facility. All three have tested negative this morning. However, we can expect that they will become positive in coming days. Genome sequencing is underway on the positive case, and results will be known by Tuesday morning. However, based on the information we have, it appears possible that this new positive case has the highly transmissible UK variant. The past year has been unlike any other. Western Australians have done an incredible job. It's something I'm very proud of. But as we have always known with COVID, it can change very quickly. Today we need to go back to what we know best to ensure we limit community transmission of COVID-19 in our state. Even though it was nearly 10 months ago, WA has experienced community transmission of this virus before. We all did the right thing and we crushed it. And it worked. So beginning at 6 p.m. tonight, the whole Perth metropolitan area, the Peel region and the southwest region will be going into full lockdown. This lockdown will last until 6 p.m. on Friday, a 5-day lockdown. It's crucial we act quickly to keep the community safe. We cannot forget how quickly this virus can spread, nor the devastation it can cause. Following our discussions with the Chief Health Officer and Police Commissioner, the following measures will be put in place from 6 p.m. tonight. People in these regions are required to stay home, except for the following 4 reasons. Shopping for essentials like groceries, medicines, and necessary supplies. Medical or healthcare needs, including compassionate requirements and looking after the vulnerable. Exercise within their neighbourhood, but only with one other person and only for 1 hour per day. Work where you cannot work from home or remotely. In addition to this stay-home rule, if you do leave home for one of the 4 reasons, you will be required to wear a mask at all times outside, and if you need to do work indoors, then wearing a mask is also mandatory. To be clear, mask wearing on public transport is also mandatory. People in the Perth, Peel or Southwest regions need to stay inside their region for the next 5 days, unless for an essential reason. We are strongly encouraging that everyone in this area who is from another WA region stay here. Do not travel further outside of this area until the lockdown is over. If you do need to travel outside the region, you are now if you do need to travel outside the region you are in now, that can only occur if you need to return to your place of residence. The transport of essential goods into this region is permitted under our existing transport guidelines. This lockdown means the following businesses, venues and locations need to close for the next 5 days. Pubs, bars and clubs, gyms and indoor sporting venues, playgrounds, skate parks and outdoor recreational facilities, cinemas, entertainment venues and casinos, large religious gatherings and places of worship, libraries and cultural institutions. Restaurants and cafes will close and provide takeaway service only. 10 people can attend funerals. Weddings are cancelled for the next 5 days. No visitors are permitted to your home unless caring for someone vulnerable or in an emergency. No visitors will be allowed in aged care homes unless exceptional circumstances. No visitors to hospitals and or disability facilities unless exceptional circumstances. Elective surgery and procedures for categories 2 and 3 will be suspended from Tuesday 2 February. Category 1 and urgent Category 2 surgery will continue. For a majority of schools, school was due to start tomorrow. That has now been put on hold, and schools will be closed until next week, following the lockdown measures. It is in effect an extension of the school holidays.